Hello, Evan Argintar, orthopedic surgeon, MedStar Washington Hospital Center, and assistant team doctor of the Washington Capitals. Briefly, I'm going to talk about the anterior cruciate ligament, what that ligament does, what the treatment options are, and what athletes should expect after injury. The anterior cruciate ligament is a ligament. A ligament attaches a bone to a bone, and it provides joint stability. If you can imagine, my hands are a knee. The ACL provides rotational stability. So without it, the femur bone can rotate off the tibia, and this gives instability, pain, swelling. And if you're an athletic person, or even if you're not, a lot of times the knee is a source of problem for you. Now, when the ACL tears, usually people do seek medical care because of the pain. Now, you should know you don't have to have a surgery for this. Again, the ACL gives rotational support. So if you're someone who's sedentary, does a lot of walking, or even rides a bike, well, the reality is you don't need an ACL for those activities. But most young active people who do any type of sport requiring pivoting do decide to get ACL surgery. And there are a couple options for surgery. Classically, we would do an ACL reconstruction. Unfortunately, when the ACL tears, it usually tears right in the middle, kind of like spaghetti. And when that occurs, you have to do a reconstruction, which means you take a tendon from another part of your own body, or even from a cadaver, and you put it in the exact place where the old ACL was. This works great. Recently, and uniquely here at MedStar Washington Hospital Center, both myself and Dr. Wimi Dwogi are beginning to do ACL repair. Now, you have to have a very unique type of tear for this, meaning that instead of ripping in the mid-substance, it rips off the femur, and in this case, you can actually put it right back from where it came from. Usually, the MRI can help me and my colleague, Dr. Dwogi, decide if you're the right candidate for this. Once you have a surgery, usually the standard athlete takes about 8 to 10 months to get back to playing sport. But in 2016, our protocols are very much patient-specific. We are currently involved in research and are very happy to share that if you're one of those unique people that can get their ACL repaired, we seem to think that these patients are getting back quicker and sooner.
Hi, I'm Justin Cooper, sports medicine physical therapist with MedStar Health. We're here today to show you some proper technique for some exercises and plyometrics to either help you prevent ACL injury or make a full recovery after surgery. We're here with Kelly Berger. She's a former local high school lacrosse player and then went on to be an All-American at James Madison and played with the U.S. national women's lacrosse team. She's also suffered 2 ACL ruptures and has made a complete recovery back to a high level with the women's national team since then. So she knows what it's like to go through this, and she's going to demonstrate proper technique. Keep up the hard work.
This month, we're going to take some time to break down our ACL program. For this week, let's talk about the flexibility and stretching that's required to not only prevent ACL injuries, but also in your road to recovery from an ACL injury.
Prone rectus femoris stretch. Keep your bottom foot planted on the ground and slid forward. Don't arch your back. Keep your back leg in line with your trunk. Hold 30 seconds. Relax your upper body. Hold the stretch. Make sure you feel it in your thigh. Seated hamstring stretch. Raise the top leg flat on the table. Keep your bottom leg planted. Make sure you keep that back straight. Don't arch. Don't lean forward or bounce. Hold for 30 seconds. Make sure you feel it in the back of your thigh. Gastroc stretch on a step. Step on, place the ball of your foot on the edge of the step. It's okay to hold on. Keep the knee straight as you let your heel drop down toward the floor. Hold for the full count. Relax as the muscle stretches in the back of the calf.